Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, New Year, New You, Essential Health Screenings for Every Age, presented by Dr. Hanisha Geedipally, Internal Medicine with Washington Township Medical Foundation. Dr. Geedipally is a dedicated and proficient internal medicine physician with comprehensive clinical training and a strong academic background. Throughout her career, Dr. Geedipally has demonstrated a commitment to patient care, research, and medical education. Dr. Geedipally's approach to medicine emphasizes building strong relationships with her patients to help them take an active role in their health and decision-making. Please welcome Dr. Geedipally.
Hello everyone, I'm Dr. Hanisha Geedipally. I'm a primary care physician with Washington Township Medical Foundation. Imagine a world where you can prevent and detect health problems before they even show up. That's the power of preventive screenings. The goal of our presentation and discussion today is to equip you and empower you with the knowledge you need to make informed health decisions. Preventive health involves regular checkups, screenings, and healthy lifestyle choices to proactively address potential concerns before they become serious health issues. So what are preventive screenings? Think of preventive screenings as routine maintenance for your car. Just like regular oil changes and tune-ups keep your car running smoothly, preventive screenings keep your body healthy. Most people think preventive screenings are done when you show up with symptoms, but that's not true. We use these to detect problems even before you show any symptoms or signs of the disease. There are many benefits to preventive screenings. Some of them include increased chances of successful treatment and recovery and reduced risk of complications and long-term health issues. These recommendations are based often on age, sex, and family history. There are many different organizations with many different sets of guidelines. The ones we're going to be using for reference today are from the USPSTF that are used by many doctors. The U.S. Preventive Services Task Force uses a rigorous, evidence-based process to develop their recommendations. They base their recommendations on a thorough review of scientific literature on a particular preventive service and an assessment of its benefits and harms for different populations. Despite the recommended guidelines, preventive care is always a shared decision-making process. It involves taking into account each patient's situation, history, and their personal preferences. Although there are many benefits to preventive screenings, there are also some harms. This is why shared decision-making is important. It involves explaining the purpose, the potential benefits and harms of each screening. It also involves considering individual risk factors, patient preferences, and their values. We also provide resources for patients so that they can make informed decisions about what is right for them and their health. When the decision to undergo screening is complex, while early detection can be beneficial, it is important to consider potential harms like false positives, overdiagnosis, and unnecessary procedures. Each patient's situation is unique, and recommendations will always consider their individual preferences. Preventive health also includes regular checkups. Some of these can be annual exams, which are done on a yearly basis, and these help detect overall health and catch any issues early. They also include cancer screenings like mammograms and colonoscopies. These also include routine immunizations, including yearly immunizations, as well as age-based recommendations. And then part of your regular checkups also involve chronic disease management for things like diabetes, hypertension, and heart disease. Let's start by discussing cancer screenings. We'll start off by talking about colorectal cancer. Colorectal cancer, or colon cancer, is the third leading cause of cancer death in both men and women. The incidence of colon cancer, specifically adenocarcinoma, has been increasing by almost 15% from 2002 to 2014 to 2016 in adults aged 40 to 49 years. We recommend screening for colon cancer for all adults between the ages of 45 to 75. However, the starting age for screening and the intervals at which you're screened may vary based on family history of colon cancer, personal history of polyps, genetic syndromes, etc. There are many tests available to screen for colon cancer. There's stool-based tests and direct visualization tests. Some of the stool test options are FIT test every year or a stool DNA FIT test every 3 years. The FIT test, also known as fecal immunochemical test, uses antibodies to detect blood in the stool, and the stool DNA test detects DNA biomarkers for cancer in the cells that are shed from the lining of your colon. Some of the direct visualization test options include a colonoscopy every 10 years, CT colonography every 5 years, flexible sigmoidoscopy every 5 years, or flexible sigmoidoscopy every 10 years with a yearly FIT. Now, these are the general recommendations. You may get a colonoscopy, and if the doctor finds something, we do shorten the interval. So that is why these are all individual recommendations, and you should always talk to your healthcare provider about how often you should be screened. Let's move on to cervical cancer. Thanks to widespread screening and vaccination, cervical cancer deaths have decreased significantly. Cervical cancer is highly preventable through screening and vaccinations. It's one of the few cancers that's actually caused by an infection. The number of deaths from cervical cancer in the United States has actually decreased substantially since the implementation of widespread screening and continues to decline, from 2.8 deaths per 100,000 women in 2000 to 2.3 deaths per 100,000 women in 2015. Even then, most cases of cervical cancer that occur today are among women who have not been adequately screened. So who is cervical cancer screening for? It's recommended for women between the ages of 21 to 29 years with screening with cytology alone every 3 years. For women between the ages of 30 to 65, we screen every 3 years with cytology alone, or we can opt to screen every 5 years with high-risk human papillomavirus testing alone, or every 5 years with co-testing, that is cytology plus screening for HPV. HPV is the virus that causes cervical cancer. We do now vaccinate children for it between the ages of 9 and 11, but we can extend vaccination all the way up to the age of 26. We do not test for women under the age of 21, and the reason for this, regardless of their sexual history, is because of the slow progression of the disease and the high chances of regression in that age group. This recommendation applies to all women asymptomatic with the cervix, regardless of their sexual history. In the same way, for those with a precancerous lesion that was adequately treated, we extend screening for another 20 years, even beyond 65. Like I said, this is where the individual recommendations come in and why talking to your healthcare provider about what is right for you is important. Next, we'll talk about breast cancer. Breast cancer is the leading cause of cancer death in women, but early detection can lead to significantly improved survival rates. Breast cancer is the leading cause, second only to lung cancer. Even then, racial disparities persist. Black women face higher mortality rates from breast cancer and more aggressive tumors despite similar screening rates. Incidence is also rising in younger women. There's been a concerning increase seen in women aged 40 to 49 between the time period 2015 to 2019. So screening for breast cancer is done every 2 years for women aged 40 to 74 years. In women with dense breast tissue, although dense breast tissue itself does not lead to a higher risk of breast cancer, it has been associated with a higher risk because of the reduced sensitivity and specificity to mammograms in this population. However, there is still insufficient evidence to recommend additional screening, such as an MRI or ultrasound in this population, and that is why additional screening requires shared decision making. Let's talk about lung cancer. Lung cancer is the second most common cancer and the leading cause of cancer death in the US. Let's go over the risk factors for cancer and the screening recommendations for high-risk populations. The most important risk factor for lung cancer is smoking. Smoking is estimated to account for about 90% of all lung cancer cases, with a relative risk for lung cancer approximately 20-fold higher in smokers than in non-smokers. The same way, the risk of lung cancer increases with cumulative quantity and the duration of smoking, but decreases with increasing time since quitting for those who formerly smoked. So you can actually reverse your risk of lung cancer the longer it's been since you quit smoking. We recommend screening for lung cancer in patients between the ages of 50 to 80 every year with a low-dose CT scan, and only in patients who've had a 20-pack year smoking history and currently smoke, or in those who've quit in the last 15 years. Screening should be discontinued once a person has not smoked for 15 years or develops a health problem that limits their life expectancy or the ability or willingness to have curative lung surgery. Now, let's talk about prostate cancer. Prostate cancer is one of the most common types of cancer in men. In the United States, the lifetime risk of being diagnosed with prostate cancer is approximately 11%, and the lifetime risk of dying from prostate cancer is 2.5%. However, the screening for prostate cancer is more of an individual one than any other screenings because of how controversial it is. The decision should be completely on an individual basis. It's done for the age group of 55 to 69 years, and although screening offers a small potential benefit of reducing the chance of death from prostate cancer in some men, there are many men who experience potential harms of screening, including false positive results that require additional testing and possible prostate biopsy, overdiagnosis and overtreatment, and treatment complications such as incontinence and erectile dysfunction. This is why we always explain the benefits and risks of prostate cancer before proceeding to screen. Immunizations are an important part of preventive care for people of all ages. Vaccines are safe and effective, and they've saved countless lives and continue to protect patients of all ages from preventable diseases. There's different types of vaccines. You have your annual vaccines, such as the flu vaccine, which we recommend for everyone on an annual basis. We do this annually because the strains of the flu virus do change from year to year, and this is recommended for all patients to prevent the complications of the infection and the severity of the disease. There's also vaccines that are recommended for the older population. We have the shingles vaccine and the pneumococcal vaccine, which are recommended for all adults above the age of 50. We have the RSV vaccine, which is recommended for some over the age of 60. However, all adults over the age of 75 should be getting the RSV vaccine. There's also a Tdap vaccine that protects you against tetanus, diphtheria, and pertussis, and it's recommended that you get it every 10 years. Some vaccinations like meningococcal or pneumococcal vaccine are not just age-based, but they also depend on your risk factors. If you're diabetic, if you're immunocompromised, if you have a history of lung disease, we do recommend that you get these vaccinations done earlier than the regular population. There's also a special category of vaccines called the travel vaccines. These are recommended for travelers doing international travel to protect against region-specific illnesses. Some examples of these could include hepatitis B vaccine, the yellow fever vaccine, sometimes even the rabies vaccine. Some of these vaccines are offered in our clinics, and for some, you will have to go to your local travel clinic to make sure you get all the vaccines depending on which country you're traveling to. One of the questions I get asked most frequently is, "Hey doc, if I get the vaccine, will this prevent me from getting the infection?" And the answer is no. Vaccines do not prevent you from getting the infection. However, they do greatly impact the severity of the illness and the severity of the complications from the illness, which is why we do recommend everybody get the appropriate vaccinations for their age. We spoke about cancer screenings and we spoke about vaccines as a part of preventive health. Now, what about preventing and managing chronic conditions? Conditions such as heart disease, diabetes, and hypertension have a severe impact on your quality of life if not caught and managed early on. The way we do catch these diseases and control them is by regular screenings and routine physical exams and routine lab tests. Some of these lab tests include checking your blood glucose, fasting blood glucose, checking your hemoglobin A1C. We do a lipid panel to monitor your cholesterol, and every time you visit the doctor's office, you probably have your blood pressure checked. Part of my job as a primary care physician is not only to talk to you about cancer screenings, vaccination, routine checkups, but also to ensure you're making healthy lifestyle choices. This includes taking care of your nutrition. Eating a balanced diet rich in fruits, vegetables, and whole grains can support your overall health. We recommend that patients eat a diet that is low in processed foods, low in carbohydrates, and rich in whole grains, whole nuts, and healthy fats. Exercise is also important as it's been proven to have an effect on cardiovascular health and your mental health as well. Regular physical activity is recommended. We recommend at least 150 minutes of moderate intensity exercise per week or 75 minutes of high intensity exercise. Moderate intensity exercise can look like just walking, gardening, anything like that, and high intensity exercises include running, jogging, swimming, things of that nature. We ideally recommend exercises that will increase your heart rate by at least 30% from baseline, and that is what counts as adequate exercise. Apart from nutrition and exercise, it's also important that you get enough good quality sleep. Getting enough sleep is crucial for your physical and overall mental well-being. I just want to end our discussion today by summarizing that preventive care looks different for different age groups. When you're a child or an infant, the focus can be on routine visits and developmental screenings. As you grow older and come into adulthood, it looks like cancer screenings and making sure we're managing your chronic diseases. And then for older patients, it's more specialized towards maintaining their chronic conditions and then age-appropriate vaccinations and screenings for them. Let's remember that preventive screenings are a cornerstone of good health. They empower us to take care of our well-being and partner with our healthcare provider to detect and address potential health concerns before they become serious issues and escalate. By embracing preventive care, we're not just checking off boxes or following guidelines, we're actively participating in our health journey. Let's prioritize our health, engage in open communication with our healthcare providers, and take a proactive step towards a healthier future.
Thank you, Dr. Geedipally. We do have a couple of questions. Regarding sleep, what is the recommended amount of hours per night?
Well, that varies, again, depending on your age. Like a lot of answers in healthcare, it all depends on the patient and the age. Usually we recommend about 7 to 9 hours of sleep when you're younger. As you grow older, the requirement actually changes, and what's considered normal is different than what's considered normal when you're much younger. So as you're growing older, we do say about 5 to 7 hours is actually sufficient. More like 6 hours is a good in between. So as you grow older, the need for your sleep decreases. Patients tend to wake up earlier than they did before, and sometimes they come to us with that actual concern that I'm waking up early, I'm not able to get much sleep, and they say they're sleeping much less than when they were younger, and the reason for that is it changes, and it is normal, and I tell my patients this as well. What's more important is the quality of sleep. Are you sleeping without waking up throughout the night? Are you sleeping and waking up feeling well rested? Those are factors that I care about more than making sure that you get 8 hours of sleep or 9 hours of sleep.
Okay, thank you. And our next question, can I request a certain screening from my doctor if I have concerns?
That's a good question because I get asked that all the time. I get patients requesting different types of screenings, and this is where that shared decision making that we were talking about comes into play. One of the factors that go into that is it age appropriate for you? Because if it's not, then insurance may not cover it. So do you really want to pay out of pocket for that screening when it's not necessary, when it's not even necessary? The other thing is, like we mentioned, there's also some harms to screening. It depends on what the test is, but if it's not really necessary for you, we do not recommend that you get screened just because you can, even if you're able to pay, because it can lead to more harm than good.
Dr. Geedipally, thank you for this insightful presentation. This concludes our program, and thank you viewers for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.